Welcome to the ICT&health Podcast with Lucian Engelin and Jessica Workham.
Welcome to another podcast from ICT&health, right from the conference in Maastricht in January 2026, where my guest now is Dr. Larry Brilliant. Larry Brilliant, and you might know of how he helped and was crucial in eradicating smallpox in the world, had it google.org, but also was with the WHO, and is the one that brought the science to the famous movie Contagious, Larry, where you said you were an extra. And maybe you could explain also our non-US audience what an extra is in a movie.
An extra is usually somebody is paid by the day. They're not a named actor or anything like that, and they're literally extraneous, I think, to the story. The reason we made the movie Contagion was that we had a pandemic in 2008. If you remember, swine flu. Remember it?
Yeah, a swine flu.
Yeah. And it was something that was H1N1, to be technical, the genome of it. H1 and N1 are the two proteins on the surface of the virus, exactly the same as in the 1918 pandemic. So the medical community was afraid that this could be a repeat of something that killed 100 million people. And quickly we got a vaccine, and we vaccinated more people, I think, than anything had ever been done before. The virus actually spread to over 2 billion people. It was a real pandemic, but it did not have a high death rate. Unusual. And it doesn't have to be that high if you're infecting 2 billion people. If it's got 0.001 death rate, that's horrible.
That's still a lot of people.
So the media felt that it was underwhelming because not that many deaths took place. So some friends of mine, Jeff Skoll, who was the head, owned Participant Media at that time, and some others, we decided it would be good to have a film that portrayed what a real pandemic would look like, because we're all worried, not even now, about the next pandemic. And I wanted to do a documentary, and they said, silly boy, nobody will watch it. We have to get Hollywood movie actresses and actors and great director. So we wound up with Steven Soderbergh, one of the world's greatest directors, and we had Gwyneth Paltrow in it, and you had all these famous actors and actresses in it. We modeled many of the people in it on the heroes of public health, on Bill Foege and D.A. Henderson and Nicole Grasset. We used them as role models for it. And my role was to do the science in it, and to bring great scientists, so that while it was a fictional movie, we invented the virus.
And authentic.
It's very authentic. Yeah. And I think that when it came out in 2012, people were worried that there might be a pandemic, but it didn't get the kind of excitement that it got when COVID began. And it became the most watched movie of all time.
It was re-rolled, actually.
Yeah. And in a way, that's a real lesson to all of us in public health. We have to figure out what is the right way to communicate. And sometimes fiction is a better communicator than
can say that.
Facts. And I think it's fair to say that we were so careful on the facts, we didn't exaggerate. Because in a pandemic, you don't have to exaggerate. Real life is...
Yeah, the pandemic itself exaggerates. Yeah. So we're here at this conference. We had already a panel. Later today, you will have your keynote. And one of the questions that we ask all our podcast guests is, how do you think that the future looks like? What is the future in your eyes that you see in front in terms of everything happening within health and healthcare?
So we're talking about the future of health. We're not talking about politics now.
That's another podcast series.
That's another part. Well,
Nobody listens.
In America, politics and health have become intertwined.
Yeah, I can see that again.
Yeah. And not favorably. So,
future.
Since we started talking about pandemics, it's easy to understand a pandemic of smallpox or a pandemic of COVID. We know what that means, a pandemic. It's actually a funny word. It just means pan, all, demic, the people, all the people. It really comes from the old English expression, a pox upon your house. And a pandemic is when it is on everybody.
Okay.
So We have today a different kind of a pandemic in health that we need to think about. Over the last 125 years, life expectancy has virtually doubled from about 40 to about 80. But with that doubling of life expectancy has not come a doubling in health span. Quite the contrary. The percent of our time that we spend today that's part of lifespan but not part of health span, it's called the health span lifespan gap. I like to think of it as sick span. The percent of time that everybody listening to this will spend in sick span has increased so that it's the highest percent of our life that it's ever been. And the United States ranks 35th out of 38 developed countries in a bad way in the percent of life that we spend in sick span. And why is that?
Raises the question, who's first, by the way?
Who's the worst or who's the best? We're not the fourth best. We're the fourth worst.
No, but who is the best?
I think, the best will be a funny answer because we always think of Japan, an aging society, life expectancy maybe 82, but they only spend 10 years in sick span. So when you take the 10 and divide it by 82, they're the best, even though maybe they've got the biggest problem with longevity. Yeah. And then you come to Northern Europe and many of the European countries, and then you get to the smaller countries like Singapore that's doing so well. But it's really this question of, we all have watched our parents, our grandparents, our uncles, friends of our parents who have gone through in their final days cognitive impairment, Alzheimer's, cancer and its treatment. God forbid you're 76 years old and you have osteoporosis and you break your hip. Yeah. That can be a death sentence, fatal, or it can be a lingering illness for 15 or 20 years. We need to find a way to solve that. And as an epidemiologist, I look at the 15 things that in the aggregate explain all of sick span. And surprisingly, number one is musculoskeletal. Lower back pain keeps people out of work. You get put in a wheelchair for life. Number two is probably heart disease. Number three is probably cancer. And number four, you want to say Alzheimer's, but it isn't really. But let's assume that Alzheimer's is 5 or 6, and you've got metabolic diseases like diabetes and obesity, and you've got infectious diseases and accidents. You've got mental illness. You've also got something that's different than mental illness. It's called despair. And it's not a sickness. It's a kind of normal reaction to a terrible lot of things happening to you in your life. If you lose a child, a spouse, that causes such grief, people sometimes never get out of it. But if you do all of these and put them together in a basket, they are what cause this increasing amount of time that we spend in these chronic diseases instead of infectious diseases. Because, although I worry very much about America's policy towards vaccinations, childhood vaccination has ended deaths from measles and deaths from diphtheria and pertussis and tetanus. Polio. And polio, we're so close. Yeah. It's tantalizingly close, but we're not there yet. We had 8 cases last year only in Pakistan and Afghanistan, but we're so close. But, we'll get there. I pray that we will get there. So the pandemic that I talk about or that I worry about is that with the increasing amount of time we spend in these chronic diseases, the world just looks to us as our family are suffering so much. And we think that that's our personal destiny also. I want to tell everybody that's not normal. This is not the way it's always been. It's not necessary. And then most importantly, by far the majority of those years of sickness are preventable. And now...
And by far is like 50, 60%? What do you think?
I think the consensus is 50 to 70%.
That's what I learned.
Yeah, somewhere in there. I mean, we don't know.
It's the majority. It's
the majority.
Yeah.
And just some numbers.
Even 25% would make sense.
Even 1 year of preventing sick span, according to McKinsey and the University of Oxford, is worth $38 trillion to the U.S. economy over a decade. $3 trillion a year, which sounds like, BS, But when you unpack that number, it's real. Now extend that to the whole world. Look at what the impact would be if we could increase healthy longevity by 1 year or reduce sick span by 1 year. Actually, to me, the future looks like that. It's a binary choice. If we can create a meme, let's all reduce sick span by 1 year. Doesn't sound very romantic. We need a little help with the...
We need to help. We need to find someone for help, just like you did with the movie.
Yeah, we need somebody to explain why that is an imperative. If we can do that, and if that's a meme, if that's a mission, if that's a movement, country after country adopting it, reduce sick span by 1 year, increase average health span by 1 year. I want people to know that unlike the concierge longevity movement, if you say that we are going to increase health span on average by 1 year, that is not an elite program. As Paul Farmer, my friend, would always say, have a preferential option for the poorest and most vulnerable. Yeah. And that's what it does. Because if you're going to increase average years of healthy longevity, where are you going to get those years? You're not going to get them from people who already live to be 100 and healthy. You're going to get them from the poorest and most vulnerable. You'll also change hospitals, health systems, insurance, because 80% of all the money we spend on healthcare is spent in those 15 years. Now, I'll use the U.S. numbers. I can use the European numbers as well. But in the U.S., we spend $5 trillion a year on healthcare. That's almost 20% of GDP. Think about that. It was actually 5.7 trillion last year. If 4 trillion is spent during 15 years of life, and you can change that to 13 or 12, think of the impact that would have.
Yeah.
And it will save hospitals from going bankrupt. It'll save health systems from being unable to perform.
And it will shield and guard access to healthcare in the broader sense.
In the broader sense. And this is something that you can do. I love the new drugs that are coming on board. Sure. I love repurposing of these great drugs. I love pharmas. There are really good people in pharma who are trying hard to find ways to increase longevity. But it's possible that we will find the simplest things that will increase longevity. I'll give you an example if I can. A friend of mine, Jim Allison, who won the Nobel Prize for discovering checkpoint inhibitors, immunotherapy. If you take a checkpoint inhibitor and you've got lung cancer or kidney cancer, it increases your life expectancy by a few single-digit years. But that's wonderful. If by chance you've taken a COVID vaccination within 90 days of starting it, and many people did, by chance, it doubles your life expectancy.
Wow.
Anybody listening to that who has had that experience in their family, to you I say first my love and compassion, but think about that. These non-obvious correlations, these accidental findings, this is what has populated the movement of medicine throughout the years. You think about how the smallpox vaccine was created. You think about how Fleming noticed a mold that stopped his bacteria from growing. From that, we have the whole field of antibiotics. Yeah. Every one of these things. You think about the way in which it was a lizard's venom that gave us GLP-1 drugs. These are all accidental findings. I think we must have a march to find all these non-obvious accidental findings on purpose. And if we do that and we add prevention back into medicine, then I think we can solve the problem of sick span.
So one of the thoughts I had a while ago when we all started to think about the things that we see happening in communication with social media and influencers and what have you, why don't we bring in this top-notch guys and girls from the tobacco industry that obviously do a great job in convincing their targeted groups in starting using vapes and smoking and stuff like that. Obviously, they're able to convince people into it. Let's utilize the same strategy, technology, and knowledge for the better in terms of how do we create that meme? How do we create that movement that you are looking for to, in the end of the day, create a better world for it?
Lucien, this is one of the wonderful things about being friends with you. You're always the out-of-the-box thinker. And that creative, I have to kind of swallow hard. Because I still remember seeing all the executives from the tobacco companies testifying in Congress, raising their hand and saying, cigarettes don't cause cancer. But you're right. I mean, the tools of communications are not tools that come easy to scientists, and public health especially. Unfortunately, I think that the reaction to the way in which the COVID epidemic and pandemic was dealt with, the disinformation that has followed it has made it so difficult for the average person to say what's real and what's fake. Yeah. Did Bill Gates really put a microchip in the vaccine to take over? Of course not. But these crazy things have populated the imagination more than the enormously more amazing thing of getting a vaccine out in 6 months.
Let's get into the next and final section of this podcast. We ask all of our guests, what was the biggest barrier that you walked into your professional life that you thought, I am never going to fix this one, but you did? And what was crucial in being able to fix it? Was it technology? Was it perseverance? Was it coincidentally happening stuff? So what was the biggest barrier that you...
I'm going to give
I would wake you up in the middle of the night, Larry, what was the biggest?
Well, I'm going to give you the solution first, because last night you were kind enough to take me to the hall in which the European Union was birthed.
Yeah, the euro, the coin, the
euro
currency.
And the currency.
Yeah.
And we saw the documents that were signed, and we saw how so many countries came together. You might say they gave up a little bit of their sovereignty.
They all did.
In order to do something that was for the greater good. And I think that was how we solved the problem of smallpox. But let me tell you, my biggest obstacle, it was without WHO, we would not have been able to eradicate smallpox. Smallpox eradication cost $200 million. Every year, the world gains 5-10 billions, almost $1 trillion so far in benefit by not having to vaccinate, by not solving...
In terms of business case, that runs rock solid.
Well, also not having to see children die.
Yeah, of course.
In the 20th century, which I tell everybody, the 20th century was only 27 years ago. Yeah. In the 20th century, 500 million people died from smallpox. Yeah. People didn't think of it as an epidemic or a pandemic. They thought of it as a normal occurrence. In fact, in India, it was called spring sickness.
Spring sickness.
Bashanto in Bengali. And, you know, Lord Macaulay wrote a couple articles about you'll never get rid of smallpox. It comes as the night, the day. And because of that, even at WHO, there was a big division in whether it would be possible to eradicate smallpox. Smallpox was the fourth disease the WHO tried to eradicate. We failed with malaria, we failed with yaws, and we failed with cholera. So those diseases made people pessimistic that you could ever eradicate it.
It's never going to work. That's the essence.
When we were getting down towards the problem of smallpox in its historical home, which is India, Bangladesh, Nepal, Sri Lanka, the Southeast Asia, Pakistan, this is where smallpox had lived forever and ever and ever. And while it would be quiet, maybe in London for a couple of years, would come back from there. And India was so densely populated that you could vaccinate every single person in India, and then a year later, you'd have to do it again because there'd be 30 million babies born. And so there'd be as many people born each year as all of Australia had in population in those days. The mass vaccination didn't work. Bill Foege, who passed away day before yesterday, came up with a novel new strategy, so an innovation. And the innovation was don't vaccinate everybody, just find every single case. Literally, we had to find every single case of smallpox every place in the world at the same time.
Also due to the not availability of enough vaccines. So
yes,
they were sparse back in the days.
His first insight was because of that when he was a doctor in Nigeria. But the application of it, we had plenty of vaccine.
Okay.
The problem was you can't vaccinate everybody. And smallpox only needs a small percentage of people unvaccinated to propagate itself. You can't get herd immunity to smallpox in that way. So we now had a new tool: find everybody, draw a circle of immunity around them, vaccinate the people in their household and their neighbors. In the end, we were vaccinating a 3-mile radius around every single case of smallpox. And as we were doing this, of course, we encountered problems. Here's a village we hadn't thought of. Here's another village we're close to eradicating. No, we missed this one over here. And WHO became torn. And one person in particular became our greatest skeptic. He happened to be the head of communicable diseases at WHO, Dr. Ignatovich, and he claimed that we were fools. And $200 million may sound like a small amount today compared to the billions and trillions.
Sure.
But for WHO, that was a huge amount of money, even though it came from outside sources. So he said that we should quit and close the program. We would never eradicate the disease. We were fools, and that everybody should be fired, and that he was so confident that if we didn't get fired and we kept going and we failed, but if by chance we were successful, he would eat the tire from a Land Rover. And I have to tell you that finding every single case of smallpox in India was much more difficult than finding a needle in a haystack. We made 2 billion house calls. We had 150,000 search workers. We had doctors from 200 countries and communities, every color, every race, every religion, all working together. And that's why I think about what we saw yesterday with the Euro.
Yeah.
Everybody came together. Russia and America buried the hatchet, the nuclear hatchet, for enough time to work together. And when we finally got to the last case of variola major, the killer smallpox, and the last case, Rahima Banu, a little 3-year-old girl.
Which you've seen. You were
I was there.
with her.
I was with her. And when I saw her and the scabs fell off of her and they were cooked by the hot sun in Bangladesh, that was the end of an unbroken chain of transmission going back to Pharaoh Ramses V.
Wow.
And that moment, of course, has propelled me for the rest of my life.
Of course.
Because when I came as a 27-year-old and started working in the program, there were millions and millions of children who were dying of smallpox. And
So there's a Land Rover with 1 tire less.
I have to say, yes, there is a Land Rover, but I have to tell you that it's not Schadenfreude or anything like that. But
No, of course.
when Nicole Grasset and I were driving in her Toyota, and we had taken the Land Rover tire, and we had put
You did. You actually did.
We did it, and we put it in a crate, and we got WHO to agree that they would pay for shipping it to Geneva, where the communicable disease headquarters was. And Nicole, this wonderful French, Swiss virologist who was heading the program, and I was working for her, she wrote a very beautiful letter. Dear Dr. Ignatovich, as agreed, we have eradicated smallpox. As agreed, here's the tire. We ask you to kindly remit and tell us if the bouquet and the texture was to your liking. And if you should desire a condiment, please let us know and we will supply it. And that was the most joyous moment that I could think of. We did it, and we sent the tire. He never responded.
That was my next question. Well, Larry, we can talk for hours, and also about your new adventure together with your son Joe Evity. We will create a separate podcast recording about that one of these days. Thank you for being here. Thank you for all the work that you've done. And I only can imagine all the work that's still coming, not only out of the steps that you've made, but also about the wisdom. Thank you very much.
Thank you. Thank you, Lucien.